Well, 1 in 3 women in Canada and 1 in 2.5 in the US will have an osteoporotic fracture. So that's pretty common. Like most women, groups of like say 3 friends or 5 friends, if you know that in your group of three, one person of those three is going to have a broken bone because of osteoporosis, that risk is pretty high. And the first thing that happens in terms of like weak bones and the type of fracture is a wrist fracture. So just falling on that outstretched hand, the wrist can break, and those can happen around the age of 50. The next that happens are vertebral fractures, or like the back fractures. So you fall, break your back. Those increase after age 65. And then 10 years down the road is when hip fractures can occur. So if these happen, so you break your wrist, you break your back, you break your hip, the biggest thing that happens is that loss of independence and loss of functionality. So there's things like going to the bathroom, right? Being able to pull up your pants and getting in and off the toilet, getting dressed by yourself, being able to cook and function independently. That height loss, so getting shorter as we get older, the impaired balance, so getting in and out of a car, even just getting out of bed, like making sure you get up and you don't fall. Restrictive respiratory problems or kyphosis. So, as we get older, a lot of women will kind of get hunched over, and if you break your back too, it's going to restrict your breathing because of the pain caused by that. Unfortunately, if a woman breaks their hip over the age of 65, their mortality rate is 22%. So 1 in 5 women that break a hip have a risk of dying. Okay. And these risks come into play with surgery. So surgery just being a risk factor by itself, immobility, so your inability to get around, blood clots that can form because you're more sedentary, infection that can come in around the wound site, you become more deconditioned and lose that muscle mass. And then, unfortunately, if you have some kind of other existing illness or chronic disease, such as type 2 diabetes, those types of things can also become worse because of this. After a hip fracture, only about 40% of women regain their previous level of independence. So again, that's pretty huge, right? You're looking at needing potential help, or being dependent on somebody really for walking, bathing, dressing, the toileting, and household activities. And unfortunately, about half of women never really regain their previous function. And this is where things happen where you are living by yourself, potentially completely independent. You break your hip, you end up in hospital, you end up in long-term care because nobody can take care of you, and that's how you live the rest of your life. So I really want to push that home of like, what can we do to prevent that from happening and maintain our independence down the road? So, um, reducing our risk of falls, helping maintain our conditioning. We don't want to become socially isolated and then also end up depressed and really not enjoying our latter years.